Hello and welcome. My name is Michael Lichtenberg from Arnsberg Vascular Center. It's a pleasure to introduce you today to the long-term data for the VICI Venous Stent. So we have now a lot of dedicated venous stents on the market. Definitely these stents need typical characteristics. They are usually self-expandable. They need to have crush resistance across the length of stent. But they definitely need, and this is very important, have sufficient chronic outward force, but on the other hand, they need to have flexibility, and of course, they should, at the end, have a very good lumen quality after implantation. In Europe, there are a lot of dedicated venous stents on the market. These are some of the existing deep venous stents here, which are on the market. We have now a lot of data from IDE trials and registries, which we recently saw within congresses and publications. And I personally believe that's very good that we have these data to treat our patients with acute and chronic deep venous outflow obstruction. As already mentioned, dedicated venous stent need to fulfill some criteria in terms of radial force, flexibility and positioning. But I also believe they should have very good data in real-world registries. Of course, when we implant them also in very obese patients, they should be very good in terms of visibility. Below the ligament, I personally believe there is a very different story, and we should analyze these stents and their behavior below the ligament. Also, we should have a look at costs, and this would be the perfect situation, have a head-to-head comparison between the stents. There are different stent types on the market. We have on one hand side closed cell design stents. This is, for example, the VICI Venous Stent. On the other hand, a lot of different open cell stents. All these stents are laser cut 19-hole stents. And because of the different physical aspects, closed cell versus open cell, we have different performance situations which we should know when we implant these stents. The difference is clearly visible in terms of crush resistance. Closed cell design stents have much better crush resistance than open cell stents. But on the other hand, flexibility is lower with closed cell design stent than with open cell stents. The VICI Venous Stent is a typical closed cell design stent. It's a self-expanding nickel titanium, so 19-hole stent. Diameter available between 12 and 16 millimeter. Length available between 60 and 120 millimeter. Here's a typical case example after a VICI Venous Stent implantation in the external iliac vein. You could see that the lumen quality after stent implantation was very good. So here are our data from the Arnsberg Venous Registry, and especially for the VICI Venous Stent. We set up this trial parallel to the IDE trial for the VICI Venous Stent. The effectiveness endpoint within our Arnsberg Venous Registry was defined as primary patency after 36 months. We had a very intensive follow-up defined for our patients after implantation. So we rescheduled these patients after 4 weeks, 6 months, 12 months, 24 months, and 36 months. We included patients with clinical significant chronic non-malignant obstruction of the iliofemoral venous segment within this registry. We already published in 2018 the 12 months outcome data for these patients. Here you see the demographics of our 90 patients which we include in this prospective registry. We included 49 patients with post-traumatic syndrome and 41 patients with compression syndromes like the May-Thurner syndrome. You can see here the disease characteristics in terms of VCSS and CEP scores. You see the lesion location and the areas where we implanted the VICI Venous Stent. We included patients also with long obstruction situations, including the common iliac, external iliac vein, and the common femoral vein. Not many adverse events need to be reported. We have one patient to report on an hematoma, with an hematoma after puncturing the groin. We have to port 5-stent reocclusion. I will show you that in a second in more detail. We did not see any stent migration, no venous rupture, no infection, and no pulmonary embolism during or after the intervention. So here you see the very important overall primary patency through 36 months. Primary patency after 36 months, 96.0%. You could see that only 5 restenosis or reocclusions happened during the follow-up. The latest was after 139 days. After that day, no more significant restenosis or reocclusions occurred. You see the clinical outcome in terms of the VCSS analysis, and you could see that these patients, which we included in our registry, improved immediately after baseline and stayed very stable through the whole period up to 36 months. And this was significant during all follow-up times. Also in terms of CEP analysis, you could see that the patient improved from baseline to 36 months, and this was highly significant. When we compare our data from the registry with the already published IDE Virtus trial design study, you could see that the 12 months overall primary patency was in the IDE trial a little bit less than in our registry. It was 84.0%. The primary patency based on venography only for the subgroup post-thrombotic syndrome was 79.8%. For non-thrombotics, 96.2%. Of course, the big difference is that we did not perform any follow-up venography within our registry, so a direct comparison in terms of that endpoint patency rate is not that easy. After 24 months within the Virtus trial, you could see that the overall primary patency rate was 79.4%. Patients also improved significantly during follow-up within this Virtus trial. Here you see the VCSS score, significant improvement between baseline and 12 months follow-up. So in conclusion, we now have many tasty apples, many tasty venous stents on the market. These are all dedicated venous stents. I personally believe that all these stents need to have prospective registry data, prospective study data. We are treating very young patients with acute and chronic outflow obstruction, and therefore I think there's a clear need to have long-term data available for this treatment. Our registry showed that the VICI Venous Stent has very good efficacy and safety performance during 36 months follow-up. So I think this stent is a very good option for the treatment of acute and chronic outflow obstruction. Thank you very much.